Which of the following is the most common component in priming solutions used for cardiopulmonary bypass, CPB, circuits? A. Normal saline. B. Ringer's lactate. C. Blood. D. Albumin. Answer: B. Ringer's lactate. Explanation: Ringer's lactate is the most commonly used solution for priming CPB circuits. It is an isotonic solution that helps maintain electrolyte balance and fluid volume during bypass. Blood or albumin is not typically used for priming because it can increase the risk of clot formation and complicate the management of fluid balance during surgery. Why is heparin often added to the priming solution for CPB? A. To improve the oxygen carrying capacity. B. To prevent clot formation. C. To balance the pH of the solution. D. To promote circulation in the bypass circuit. Answer: B. To prevent clot formation. Explanation: Heparin is an anticoagulant that is added to the priming solution to prevent clot formation in the CPB circuit. During bypass, blood can be exposed to foreign surfaces, which increases the risk of thrombosis. Heparin helps minimize this risk by inhibiting clotting factors. Which of the following best describes the purpose of adding glucose to the priming solution in CPB? A. To maintain osmotic balance. B. To prevent hyperglycemia. C. To provide an energy source during bypass. D. To decrease the viscosity of the blood. Answer: C. To provide an energy source during bypass. Explanation: Glucose is added to the priming solution as a source of energy for the body, particularly during prolonged cardiopulmonary bypass. It provides essential energy to tissues, especially in the absence of normal circulation, to maintain metabolic function and prevent hypoglycemia during surgery. In a situation where blood is used to prime the CPB circuit, what is main reason for its inclusion in the solution? A. To match oxygen carrying capacity of blood. B. To minimize hemodilution. C. To stabilize circuit's temperature. D. To reduce risk of acid-base imbalance. Answer: B. To minimize hemodilution. Explanation: Blood is used in priming CPB circuit mainly to minimize hemodilution. Hemodilution occurs when the circulating blood volume is reduced, potentially lowering the oxygen carrying capacity and other important components like platelets and clotting factors. Using blood in the circuit helps maintain the blood's composition and prevents significant dilution, which could compromise patient stability. What is primary concern when using a priming solution that is too acidic or too alkaline in a CPB circuit? A. Risk of hemolysis. B. Risk of oxygen desaturation. C. Inhibition of heparin activity. D. Risk of cellular damage and organ dysfunction. Answer: D. Risk of cellular damage and organ dysfunction. Explanation: A priming solution that is too acidic or too alkaline can affect the pH of the blood during CPB, leading to cellular damage and potential organ dysfunction. Maintaining an optimal pH, close to physiological levels, is essential for the proper function of enzymes, oxygen transport, and cell integrity. Extreme pH levels could lead to metabolic acidosis or alkalosis, both of which can negatively impact the patient's clinical outcome. Which of following solutions is most likely to cause hemolysis during CPB if used improperly for priming? A. Normal saline. B. Blood products. C. Hypertonic saline. D. Lactated Ringer solution. Answer: C. Hypertonic saline. Explanation: Hypertonic saline, which has a higher concentration of sodium chloride than normal saline, can cause osmotic imbalances that may lead to hemolysis, destruction of red blood cells, if used improperly. It is critical to ensure proper tonicity when selecting priming solutions to avoid adverse effects. What is the primary reason for the use of mannitol in the priming solution for CPB circuits? A. To reduce blood viscosity. B. To act as a diuretic during bypass. C. To maintain blood volume. D. To prevent edema and protect organs. Answer: D. To prevent edema and protect organs. Explanation: Mannitol is used in priming solutions primarily because it acts as an osmotic diuretic, helping prevent edema and protecting organs, particularly the kidneys, from damage during the course of CPB. It draws water from tissues and into the bloodstream, helping maintain proper fluid balance and reducing the risk of organ swelling or injury. What is the primary function of adding sodium bicarbonate to the priming solution in a CPB circuit? A. To act as an anticoagulant. B. To maintain pH balance. C. To enhance the oxygen carrying capacity of blood. D. To provide a nutrient source for tissues. Answer: B. To maintain pH balance. Explanation: Sodium bicarbonate is added to the priming solution primarily to buffer the blood and maintain a stable pH during CPB. During bypass, blood can become acidic due to the lack of normal circulatory function and oxygenation, and sodium bicarbonate helps neutralize this acid buildup, ensuring that the body's metabolic processes remain stable. Which of the following is a risk associated with using too much volume of priming solution in a CPB circuit? A. Hypotension. B. Hyperglycemia. C. Hemolysis. D. Hyperkalemia. Answer: A. Hypotension. Explanation: Overuse of priming solution during CPB can lead to excessive dilution of the blood, which in turn can reduce blood pressure, hypotension. This is because the body's circulating blood volume may become disproportionately low relative to the volume of the priming solution used, causing a decrease in perfusion and cardiovascular stability. What is the role of the oxygenator in relation to the priming solution in a CPB circuit? A. To provide a source of glucose for metabolism. B. To oxygenate the priming solution. C. To act as an anticoagulant. D. To maintain osmotic balance during bypass. Answer: B. To oxygenate the priming solution. Explanation: The oxygenator in the CPB circuit is responsible for oxygenating the blood, or priming solution, as it passes through. This allows for adequate oxygen supply to tissues and organs during the period when the heart is not actively circulating blood. The oxygenator ensures that the priming solution and any blood in the circuit are properly oxygenated before returning to the patient.